Today, we're going to talk about why penile size shouldn't really matter. I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I am bringing on a very special guest, Dr. Laurie Mintz. She is a sexual psychologist, author, speaker, and she recently wrote an amazing book called Becoming Cliterate. And we're going to talk about a lot of the big topics that she mentions in this book, but I would strongly encourage you guys to read it. She has a full book dedicated to female pleasure and specifically has a full chapter about men. And so it's a great book. And in fact, people who've read this book, it's actually been studied that they've had better satisfaction with their sex life after reading this book. So I'm going to link her book down in the description as well as her Instagram. So make sure you read the book and follow her because she is outstanding. You guys are going to love this interview. We talk about why penile length really shouldn't matter, why there is such a big gap between men reaching climax and women during sex. We also talk about pornography. Is it good? Is it bad? And lastly, we answer your question about will a vibrator or toy replace me in the bedroom? Let's get to it. Laurie, thank you so much for joining me.
Thank you so much for having me. I'm so excited to be here with you.
Well, I have to say on a personal note, I loved your book. It was great. It was so well written, so easy to understand for anybody, and I highly recommend it. So thank you for writing it because it's fantastic.
Oh, thank you. That means so much to me.
So I wanted to start off and start talking about the orgasm gap. Like, what is that? What is the difference in men getting orgasms and women getting orgasms? And of course, we're using the terms male and female in this video, but of course, other people can identify as male gender, female gender, or non-binary.
So great. I love that you asked that, and I love that you gave that caveat because the orgasm gap is the consistent finding in the literature, and all this has been conducted on cisgender women and men, but in my clinical practice, I think it applies to anyone with a penis and a vulva. But the bottom line, the orgasm gap is the consistent finding in the research literature that when women and men get it on, the women are having significantly fewer orgasms than the men. So let me break it down with some striking statistics. In one study, 91% of men versus 39% of women said they usually or always orgasm during a sexual encounter. Whoa, big gap. And that study didn't ask the context of the sex, but subsequent research that has finds that the gap is biggest in hookup sex. It gets smaller in subsequent hookups and friends with benefits. And it gets even smaller in relationship sex, but it never closes altogether. Even in relationship sex, women are having about one orgasm to every man's 3.
That is so striking. And of course, as a woman, I'm not really surprised to hear that there's a gap, but the significant amount of the gap is really, really surprising to me. So what do you think really contributes to that gap?
So I have heard so many people say, oh, women's orgasms are difficult and elusive and it's our bodies. No, there's 2 other findings that say that's not what it is. So let me tell you those, and then I'll tell you what it is. So when women masturbate, pleasure themselves, 95% of us reach orgasm easily and within minutes. So our bodies aren't elusive. We know what to do when we're alone. And women have more orgasms when they have sex with women than with men. The most striking study that really underscores this was a very small study with bisexual women who hooked up with women and men. So these are the same women, same bodies. And when they had hookup sex with women, they orgasmed in first-time hookup sex 85% of the time.
Wow.
With men, 7% of the time.
Whoa, 80% versus 7?
85 versus 7.
Oh my gosh, that is just unreal. So, I've talked on this channel about female anatomy. How does female anatomy play a role in all this in the sense of male understanding of female anatomy and how to make women orgasm?
Exactly. So the cause is in our bodies, and I'm not blaming men. I love men. I have a son-in-law I love. I've been married to the same man for almost 40 years. So this is not a commentary on men, it's a commentary on culture. So the reason that we're having this gap in heterosexual sex is false images that women orgasm from penetration alone, and that men should last long and thrust hard to make that happen, when in fact, only 4 to 18% of us orgasm from penetration alone. The rest need clitoral stimulation, external clitoral stimulation, either alone or coupled with penetration. And our culture ignorance of the clitoris, our ignoring of it in heterosexual sex, and kind of revolving the whole thing around intercourse is what is underlying the orgasm gap.
That's exactly right. I mean, I think that the issue is, and I think in your book, you said that, when you look at those studies about penetration versus clitoral stimulation, in that 14% of people who did orgasm between clitoral with penetration, a lot of them were actually also getting clitoral stimulation. So really the true number was about 5%. Is that right?
That is exactly right. The older studies just said, oh, do you orgasm from penetration, and didn't break it down. And those studies said, oh, 30% can. But then later studies said, okay, can you orgasm from just penetration, no clitoral stimulation? And that's where it was like 15 or 18%. But in my research, I thought, let's take out the word intercourse because people think they should. And I asked women, what's your most reliable route to orgasm? And only 4% say penetration alone without clitoral stimulation.
Yeah, that's crazy. So as far as, getting men involved in clitoral stimulation, breaching that subject matter with your partner or introducing it in sex, I mean, some men may feel hesitant to do that. Do you have any tips for them?
Yeah. So, we know that men really care about women's pleasure. Like all those writings that this gap is about men not caring, I don't buy that. All the men I talk to care really deeply. They're just misguided by false images and lack of knowledge. So, what I would say to the men is tune into that, tune into your desire to please your partner. And then knowing that what your partner really needs is clitoral stimulation really opens the conversation. And I just suggest having a conversation outside of the bedroom and just saying like, hey, your pleasure is important to me. I want you to have fun. I want you to orgasm. I watched this cool YouTube video and I learned that most women need clitoral stimulation. I really want to learn your way. Will you tell me? Will you show me what you need to orgasm? And for most, it's oral sex, manual stimulation, or the reason I'm wearing these, vibrator stimulation. Vibrator is not going to replace you. It's your ally in pleasure.
Yeah, absolutely. That's great. And I think that you shouldn't be afraid to bring those sort of things in the bedroom with you, toys, accessories, whatever you need to get there. It makes it more fun and exciting.
Exactly.
We know that the vagina is a pretty amazing structure. And I think sometimes people have difficulties with having intercourse with their partner because there's not enough time for lubrication to happen. And that does take some time. So what do you say to people who maybe are not, getting there and not enjoying intercourse, and maybe they're avoiding it with their partner because there's just not enough time for lubrication to happen? How long does that really take?
Well, it really varies depending on the woman, and it varies depending on her level of comfort and also biology, or even just like stress, or is she on antihistamines that day? But we also know that some women produce a lot of lube on their own, vaginal lubrication. Some don't, and that doesn't mean they're not aroused. So here's what I say. Here's some really important information on the vagina. When it's aroused, it lubricates, and the cervix pulls up and out of the way. And if you have penetration before those things happen, it's going to hurt. And sadly, a lot of people don't know that. And we've got this message like it's okay that it hurts. It's supposed to hurt. It's not. And if you have penetrative sex before those things happen, it's going to hurt. So take as long as it needs. It can be 5 minutes, it can be 10 minutes. Those are a little low. I'd say 20 to 40 of really getting aroused before penetration. And lube is sex's best friend. Lube and mindfulness and vibrators, and all of those. But store-bought lube, it doesn't mean there's something wrong with your partner. It doesn't mean there's something wrong with you. Some of our bodies just don't lubricate naturally. So using lube, either a water-based or for penetrative sex, silicone is excellent, or a hybrid lube, use it. Arouse, foreplay, even though I don't like that word for reasons we can discuss, and store-bought lube, all of those.
Yeah, absolutely. And I've made a whole video about lubricants, so check it out. And I really think that it can make things a lot of fun. So you can introduce it into the bedroom being like, hey, I think this will be really fun and exciting. There's like different kind of flavored ones and scented ones, or, things like that. Of course, you want to make sure you're not sensitive to lubricants when you use them. So try it out on your skin before you use it in the bedroom. But there are so many great options out there, and I would absolutely introduce them into the bedroom with you.
Absolutely. Absolutely. Have fun. I mean, variety also is exciting. So try different ones. If they work, great. If they don't, try a different one.
Absolutely. And look for discounts, coupons. Everyone has sales, so you can try a whole bunch of different ones. So you mentioned mindfulness. How does mindfulness play into a really great sexual encounter?
Yeah, and this is for women and men. So basically, all of our minds wander all the time. Like, that's what our brains are good at, thinking ahead to problem solving, thinking back to learn things. But what that prevents us from doing is having our mind and body in the same place, in general, in life, and in sex. And to orgasm and to really enjoy sex, you must have your mind and body in the same place. And so many of us don't. We're having sex, our body's having sex, and our mind is like, do I look okay? Do I smell okay? Am I going to come? Uh-oh, I forgot to return that email. And mindfulness is noticing when that happens and bringing yourself back to the present. And so I tell my clients and my students, practice it in everyday life. You can do it by meditation or yoga, or just daily activities. The next time you brush your teeth, instead of being like, oh, what am I going to do tomorrow? Think about, like, really focus on the sensations, notice when your mind wanders and bring it back. And then you can apply that to the bedroom. And here's a really cool study to underscore this. This brain state right before orgasm is identical to the brain state of deep mindfulness meditation, in that we are self-conscious, our monitoring is gone. And so, in fact, turning off your self-monitoring with the idea of mindfulness is a prerequisite to orgasm.
Oh, that's so good. That's so good. I think mindfulness plays a huge role for both men and women, and men in particularly can get really caught up in, is their penis size long enough, or if they have an issue with performance, which happens to nearly every guy at some point in their life where they'll have an issue with performance, that can really play a huge role in being able to get erections and actually being able to penetrate. And so I think that this is so key for so many men who are suffering with issues with erectile dysfunction, but really it's a lot of it's, because of this lack of mindfulness.
Lack of mindfulness is sex's enemy, and mindfulness is sex's best friend for women and men. And it's been proven in the research over and over again.
That's so great. So let's talk about, pornography. A lot of people ask me about pornography. Is it safe? Is it setting us back? What are your thoughts on that?
Okay, so I think this is one of the most contentious topics out there, even among sex therapists. And here is what we know from research, which is where I like to turn for my information, which is that porn has some positive effects and some negative effects. So for a lot of people, it's very arousing. That lubrication we talked about earlier, erections, like, it helps you get in the mood It also can really help with like getting your brain off of other things. Some couples even enjoy watching it together. And there's some research that people who watch porn together communicate together better about sex, experiment more. So there's some positives, especially if you're watching what we call ethical porn, which isn't degrading or violent and features, some aspects of relationships, et cetera. But here's the negatives. For a small percentage of users, it becomes compulsive. They stay home to use it rather than going to work. They'd rather do that because it's less anxiety provoking than getting with a partner. Or they masturbate so firmly, men with penis, men, so intensely that they get used to a type of physical and visual stimulation they can't replace with a partner. Now, that's a small percentage of users, but if that's you, you need to seek help. And I can even give you some tips. The biggest harm that we see from pornography is people using it as education rather than entertainment. Because of our terrible sex ed system, we don't give people good information. So they turn to the internet, and what you see on porn, such as women having fast and fabulous orgasms from penetration alone, with no warm up, no lubricants, gives a false image. And even worse, we're seeing more and more, and I'm sure you've seen this and can speak to this. The anal sex is the type of activity that requires the most preparation, and without it, it can cause injury, STIs, and incredible pain and injuries. Yet in porn, you don't see any of that. It's just immediate. And we're seeing people showing up in the ER really from those kind of encounters that are mimicking porn.
Yeah, absolutely. And I think that percentage of users will continue to grow who have problems with it because it's so readily accessible. So when we were younger, right, you had to find a VCR, you had to find a tape, and you had to find a place to watch it. You couldn't just, you couldn't find a room where no one was going to walk in necessarily. But now it's so easily accessible on our phones, and it does make it, more likely that people can develop these bad habits or bad understandings of what a sexual encounter should look like, whether it's penetrative, anal, anything.
Exactly. And this is especially true for young people who, if that's their first exposure and they're given no other information, and it's so easy. So I'm not anti-porn, but I really think it has to be, what I wish, honestly, and I know this is never going to happen, but I wish we had better sex ed, and I wish that sex ed included for high school students a section on porn literacy. I don't know who said this, but you wouldn't learn to drive from a Fast and Furious movie, so you should not learn to have sex from porn. It's entertainment, not education. They're actors and actresses.
Exactly. Absolutely. 100%. The other thing that I've noticed with patients and people in general is that there's a lot of penis size anxiety. And I know that for a fact because my video on increasing penis size has 20 million views. So clearly 20 million men out there or women are interested in increasing penile length. So what are your thoughts on that?
Oh, please don't do that. Penis size doesn't matter to female pleasure, except in those rare 4%, remember 4% of people who orgasm from penetration alone. There was a study where they asked women, what's the most important thing to you during intercourse? Open-ended question. Not one person mentioned penis size, not one. They mentioned lovers who care about their pleasure, who communicate with them, who know about the clitoris. So you would be better off letting that go and spending more of your time learning about female pleasure than focusing on the size of your penis. And you will enjoy sex more too, because you can let go of those anxieties around size and stamina, pleasure her the way she needs to be pleasured, and then enjoy the sensations in your penis without worrying how big it is and how long it lasts.
Exactly. I couldn't agree more. I think it's an unpopular opinion among men because it's a part of our society, and you mentioned it in your book, and I completely agree. We as women contribute to it too, right? We oogle and ah over, large penis representations in the media, or, if you're looking at toys or things like that. But ultimately, when I've talked to men with very long penises or very girthy penises, they actually find that women find it painful sometimes to have intercourse with them. And so it's not always this great, wonderful thing to have. And as you've mentioned very clearly, it doesn't really contribute to pleasure all that much for women. Women care more about feeling connected and getting clitoral stimulation and other things that can really bring them more pleasure than the size of your penis.
Absolutely. Absolutely. And Ian Kerner has a great book called She Comes First, A Gentleman's Guide to Pleasuring a Woman. And he makes this point beautifully, that it's like, you've been sold a false good, a false bill of goods. And if you let it go, it's really going to be to your benefit to not worry about the size of your penis. Learn communication skills, learn clitoral stimulation. The size makes no difference. And we must stop, I think, making jokes about penis size, because it just contributes to this insecurity. And it's not good for anybody.
Oh my God, this has just been so great. I had one last question that comes up all the time with my audience, with my patients, is they're worried that a toy can actually replace them with their partner. And so that their partner will start looking to a toy rather than them for pleasure.
Yeah, I'm so glad you asked that, because I really, really want to debunk that. We know that vulvas respond incredibly well to vibration. Actually, so do penises too. So having your partner's vibrator down there while your penis is there, you might get some vicarious vibes that are feeling good to you. So, but in terms of replacing a partner, not at all. Vibrators don't cuddle. They don't laugh. They don't say, I love you. All they do is provide the kind of stimulation that vulvas really and clitorises respond really well to. And there's studies that show a man's acceptance of his partner's vibrator use is highly related to her sexual satisfaction. And that's what you're here for, right? To make your partner satisfied. So asking her, do you use a vibrator? Can we use it together? Don't hesitate to use it on yourself during intercourse. And here's the metaphor I love to use with people. If you were swimming in the pool with your partner and there was a raft there, and it was a beautiful day, and you jumped on the raft and you jumped off the raft and you just had a lovely day, you would not go home and call your friend and say, oh, me and my raft, we had the best day. And oh, my boyfriend was there. You wouldn't even mention the raft at all. It's not about the raft. That was just a tool to enhance the experience. And the same is true of vibrators.
Absolutely. And I would encourage you guys, if you want to, make it even more accepting, go ahead and buy your partner a toy as a gift. Show them that you're super accepting of it. And really, I think that will mean a lot to them.
Absolutely. And it's no less sex if your partner uses her vibrator on her during intercourse than if she doesn't. And in fact, she'll get more excited. You can focus on you. It's a technique that sex therapists recommend all the time.
Absolutely. Well, thank you so much, Laurie. This has been outstanding. I hope that our audience learned so much. I'm going to link Dr. Mintz's Instagram, her book, and the other book we talked about in the video down below. Make sure you check it all out. And always remember to take care of yourself, because you're worth it.
Thank you for having me.